Hello everyone, welcome to my channel Ravi Static Videos. In the series of pharmacology, we are taking another topic which is cardiovascular pharmacology. So it is also important for a university examination. So how you can write it. So first introduction. It deals with the study of effect of drug upon the heart or circulatory system. It means it is a study of drug. So what the drug do after it will be entered in our body, so what their pharmacological action, what is their bioavailability, and their indication, contraindication, also pharmacological action, as well as the adverse effect. So it mainly contributes to the safety profile of potential new drugs and provide pharmacological data that can be used for optimization of further compound and the ultimate selection of compound suitable for clinical development. It means we are studying on different kind of human being for the purpose of treating different kind of cardiovascular diseases like heart angina, arrhythmias, edema, heart failure, and systemic hypotension. So if test is successfully for a group of people, so we are moving further to make a large amount of medicine and a drug for different kind of cardiovascular diseases. So cardiac drugs affect the function of the heart, and these main ways. The first, they can affect the force of contraction. It means they act on directly on the heart contraction and relax the muscle contraction. They can affect the frequency of the heartbeat and heart rate. The chronotropic effects. They can affect the regulatory of the heartbeat. Rhythmic effects. It means the heartbeat is too much high, so it relax them. If heart is too low and hypotension, low BP, so it will increase them. So the action is to be pharmacology. We are studying further. These are common cardiac disorder. First is angina, arrhythmias, edema, heart failure, systemic hypotension, pulmonary hypotension, myocardial infarction, and hyperlipidemia. First is congestive heart failure. So what is the congestive heart failure? A chronic progressive condition where the heart cannot pump blood efficiently, causing fluid buildup in the lungs and body. It means the heart is not contracting properly. So in our lung there is a fluid accumulation. So it will be caused pneumoconiosis. And if the symptom is to be shown that the breathe, shortness of breath, apnea, fatigue, too much tiredness, weakness, dizziness, and the lungs is to be like collapse on that time, and the rise the venous blood pressure. It means the too much venous, also deoxygenated blood is to be high in our heart. And so what it will be, so if the venous pressure is to be high, so it cause the tissue too much deoxygenated blood in our tissue, and the edema, and also the right side heart failure cause. So if the venous return is too much high, so right side of the heart failure is probably caused. And the lower extremity is associated with the intravascular clotting. And in left side heart failure produce the pulmonary edema and respiratory distress. It means the heart, it is like heart, and if the pulmonary artery is going to the lungs for the deoxygenated blood converted into oxygenated blood, and after that it will be entered into the left atrium and by the pulmonary vein. So if artery is blocked and not reached out to the lungs, so if it will be a blockage in our pulmonary arteries, so there is chance to be left heart side failure is to be done. So if left heart failure is to be done, so lungs primary organ is to be affected, is to be lungs. So the lungs is to be affected, and not it will be increase the interstitial fluid into the lungs, and also the not proper working of their lungs. So it could cause the left side heart failure and the pulmonary edema to accumulation of the fluid over there. In congestive heart failure, the classification is to be shown that a patient has to be no limitation in physical activities. It means it is a first congestive heart failure is to be shown, and if patient has to be slight limitation work in their body, so the heart failure is to be goes to second stage. And if patient has marked limitation, it means there is proper not working their body part, and if their lung collapse, dizziness, fatigues occur, so it cause third stage of congestive heart failure. And if the symptom is occur our completely rest of the heart muscle, and if there is not contract properly, lung edema is also occur, respiratory distress occur, and pulmonary edema is occurred, so it is last stage of congestive heart failure, which is fourth stage. So, drug in use to treatment for congestive heart failure. First is digitalis cardiac glycosides. Example is digoxin. So, these medicine are primarily used for treat congestive heart failure. So, what is their action in our body? So, it inhibits sodium and potassium ATPase pump. It means the right side heart failure is major causes to be too much entry of the sodium and potassium in our blood vessels. So, it inhibits the cell level and not enter into the intracellular space. So, it increase the intracellular space side of the sodium and decrease the sodium and potassium ion into the extracellular matrix, and exchange is to be increased intracellular and decrease extracellular matrix, leads to positive inotropic effect. It means the increase of force of contraction. It means the sodium and potassium is not enter into the blood vessel, so it action is to be shown that it decrease the force of contraction, and negative chronotropic effect. It means decrease the heart rate via vagal action. It means if you are taking the medicine, the digoxin, so it affect over the heart muscle for the proper working and decrease the chromotonic effect. It means the AV atrioventricular conduction is to be decreased and relax the heart muscle. So what is the pharmacological action if medicine is enter our body? So increase the cardiac output. So previously the decreased cardiac output. So if you are taking medicine, so it will increase the cardiac output and decrease the heart side, and decrease the venous pressure, improve renal perfusion, and mild diuresis. Pharmacokinetics. Oral bioavailability 70%. It means patient is taking the medicine is 70% have to be shown the oral bioavailability. Half life is to be 36 hours. It means the drug action is to be 36 hours is to be present if the patient is taking medicine. And narrow therapeutic index. The therapeutic effect in our body of the heart if taking the medicine, it will be it means time to time it will be decrease the action of the medicine. Exerted mainly by kidney, excreted mainly by kidneys. It means after all of the process is to be done, after to 36 hours it will be excrete out our kidney. So indication, what time in which time we are taking the digoxin medicine, like chronic heart failure, especially with atrial fibrillator and supraventricular arrhythmias. It means supraarticular abnormal heart will be occur, and congestive heart failure, basically left side heart failure is to be there. So digoxin is to be beneficial for those patients. Next is to be adverse effect. If patient is taking too much medicine day after day, so it will be cause cardiac arrhythmias. So it will be so abnormal heartbeat, nausea and vomiting. It means vomiting occur if you are taking too much medicine, and visual blurry vision and visual disturbance, like yellowish kind of vision, and halos, confusion and hallucination you have to be shown. So that is the congestive heart failure. Thank you.